Dr. Kavita Krishna, Professor and Head, Department of Clinical Immunology and Rheumatology. Today, we shall discuss and answer certain questions pertaining to rheumatology and rheumatic diseases. What is rheumatology and what are common rheumatic diseases? Rheumatology is a branch of medical science that deals with diseases which are called autoimmune diseases. Autoimmunity is a process in which the immune system of our body starts manufacturing autoantibodies against our own body. This can affect certain systems, but predominantly it causes swelling and pain in the joints, changes in the skin, soft tissue, muscles, and in certain circumstances, the kidneys and the lungs also. There are over 50 rheumatic illnesses, but the most common ones are rheumatoid arthritis, systemic lupus erythematosus or SLE, spondyloarthropathies, psoriatic arthritis, scleroderma, vasculitis, fibromyalgia, etc. Are rheumatologists and orthopedic surgeons the same? No. As rheumatologists, we treat the joint illnesses and other rheumatic diseases by medicines only. There is no surgery involved. However, an orthopedic surgeon deals with the illnesses of bones related to trauma, accidents like fractures, or age-related joint problems like osteoarthritis of the knee or spine problems. Surgical procedures may be important in orthopedics. When should I or my family doctor refer me to the rheumatologist? We know that early diagnosis and treatment will prevent chronic disability and deformities in rheumatic illnesses. So whenever you have joint pains or swelling, we do not go away with simple medications, or along with joint swelling and pain, you have fever, weight loss, continuous pains, skin changes, ulcers, discoloration of the skin, rashes on the face, etc. Rush to a rheumatologist to get an accurate and early diagnosis and accurate treatment to prevent deformities and complications in future.
Hello, I am Dr. Sandeep Kansurkar. I am a consultant rheumatologist at Bharati Hospital, Pune. How do I find a rheumatologist? There are very few rheumatology centers in Maharashtra. Most of them are located in only big cities. Bharati Hospital is one of the biggest centers in Maharashtra which provides comprehensive rheumatology services under one roof, and it has proper expertise to handle these complex illnesses. Is rheumatology treatment expensive? Actually, it's exact opposite. Most of the initial treatments are inexpensive. Delay in starting treatment will lead to the chronic disease and will increase the cost of the treatment. So, if you are taking treatment early, you are actually saving money. And most of our patients are managed with simple, cheap, but effective medicines. How is the general treatment outcome? The general treatment of rheumatic diseases focuses on management of disease activity. And most of our patients with modern treatment are able to have a productive life and they don't have much difficulty. Gone are the days when these entities were considered unmitigable.
Good morning. I am Dr. Varsha Bhatt, Professor and Consultant Rheumatologist in Department of Clinical Immunology and Rheumatology, Bharati Vidyapeeth University Medical College, Hospital and Research Center, Pune. Today I am here to answer a few questions related to rheumatic diseases and their treatment. So what is the importance of compliance to treatment in rheumatic disease? Whatever medication we start for arthritis and other rheumatological illnesses, they all act in a step-by-step manner. They may not act in 1 or 2 days, and the patient may require a couple of weeks to a couple of months to show any kind of benefit to his condition. Therefore, it becomes very important for the patient to adhere to this treatment protocol in the correct dosage, and he or she must never experiment with these drugs or their dosages, and must follow the doctor's prescription very carefully. And because if there is incomplete treatment followed, then the patient may not show any benefit at all. How common are the side effects to these medications and how to monitor these side effects? So many of the medicines that are used for rheumatic diseases, most of the patients tolerate them really well. There are very minor side effects and often no side effects at all. And whenever we counsel the patients and their relatives for any kind of treatment protocol, we take them into confidence and explain to them about the drugs, their mechanism of action, their dosage, and also possible side effects. We also ask the patients to come every month for their follow-up with certain blood investigations, which help us to preempt these side effects in order to quickly diagnose and treat them. So, it is very important for the patients to follow up with their doctors regularly so that these side effects can be easily determined and treated. Is there any other treatment besides medicines for treatment of rheumatic disease? So, traditional solutions such as yoga and pranayama often benefit the patient's overall health, but they cannot be a replacement to the medications. Along with the medication, if a patient does yoga, pranayama, he takes healthy, balanced diet and does adequate amounts of exercise, he or she has a positive outlook towards life, then this will definitely benefit the patient's overall health and help him battle the illness.
Good afternoon. I am Dr. Jitendra Oswal. I am a pediatric rheumatologist at Bharati Medical College, Pune. Can children have arthritis? Yes. Children also can have arthritis. If your child is suffering from following conditions, then you must visit a pediatric rheumatologist. Like, your child is having a fever without any cause for going on for 2 weeks. Second, if your child has got a small and large joint swelling and pain. Third, if your child has got low back pain going on for a long time. Fourth, if your child has got rashes, especially over the face, oral ulcers, genital ulcers. Along with that, if the child has got systemic features like weight loss, hair loss, easy fatigability, difficulty in walking, then you must visit a rheumatologist because it may be a inflammatory condition giving rise to rheumatological diseases. So if your child is suffering from rheumatological disease, you must visit a pediatric rheumatologist because if you don't control the disease in time, it may lead to joint damage as well as organ damage. What rheumatological services do we offer at our center at Bharati Hospital? We have equipped Rheumatology and Immunology lab which conducts various tests like ANA blot, myositis panel, complement levels, flow cytometry, nail fold capillaroscopy and dedicated musculoskeletal ultrasound. We offer a comprehensive care for rheumatological patients. The team includes adult rheumatologists, pediatric rheumatologists, dermatologists, cardiologists, nephrologists, physiotherapists and dedicated radiologists who are expert in muscle and bone ultrasonography. So at our center we offer a comprehensive treatment for children and adults with rheumatological diseases. We use various disease modifying anti-rheumatic drugs, immunosuppressive drugs. We have got facilities for intra-articular injections and also the advanced drugs like biological drugs to control the disease in these patients.